Thank you for joining us today on the program Healthy Living. I'm Adesuwa Osa Uwagie, and I hope that you are having fun. Have you had the vaccination yet? Are you still thinking about it? I'm talking about the COVID-19 vaccination. Some churches, some persons went to churches yesterday, Sunday, and to vaccinate people, and some persons also got vaccinated. That's quite interesting. It's nice to know that Nigerians are waking up to the issue of the fact that COVID-19 is real, particularly this third phase of it, the Delta variant. We understand that it is very dangerous. It doesn't give time. Once you contract it, within hours or maximum 2-3 days, the person is gone already. So let's be very careful. Let's not forget to wash our hands. Let's use our sanitizers often. The nose masks, very important when you are in a crowded place or when you are in public. You just have to do all of that, okay? We're going to be asking our guests a little bit about COVID-19. Let's see what's going to happen. So today we're going to look at malaria. Do you know your malaria status? Or you just go with the bandwagon? Oh, because you're AA, that means you're a carrier. Because you're AS, that means you're a carrier. Or because your body's a bit warm, that means you have malaria or something. You know, people just do things without really consulting the professionals. Do you know your malaria status? Today we're going to look at all of that and how you can help yourself. All right, meanwhile, the federal government has expressed concern about the 21-day strike notice issued by the Nigeria Medical Association over the alleged failure of government to meet the demands of the striking resident doctors. The Minister of Health, Dr. Osagi Ehanire, said doctors should stop embarking on strike at dangerous times. From the Minister of Health, Dr. Osagi Ehanire, I say that again. He said doctors should stop embarking on strikes at dangerous times and appealed to resident doctors to call off the strike. I want to add my voice to that, please, okay? And the NMA, in a statement after its National Executive Council meeting, said its affiliates, including the Medical and Dental Consultants of Nigeria, the medical and dental doctors in academics, and the National Association of Resident Doctors have resolved to commence a nationwide strike after the ultimatum. The umbrella body of medical doctors noted that the federal government has not met the demands of resident doctors who began a strike on August 2. So the 21 days is over already, and the NMA expressed anger about the no work, no pay order of government against resident doctors. That's the news that I have for you today on the program. We're hoping and praying that the federal government, the striking doctors, and those who are also planning to join the strike would, you know, reason together and come to a logical conclusion that will be beneficial to you and I, beneficial to the doctors, beneficial to government, and make Nigeria a better place. We understand that some doctors are leaving the country already. It's like a mass movement. By the time you all leave, who's going to take care of us, okay? So that's why we are appealing to both parties to shoot sword, okay? Meet at a leveled ground, so to speak, so that things will go on fine. So let's meet my medical personnel here today. Is going to be talking to us on the issue of malaria. He's a medical scientist, and his name is Mr. Lawrence Idemudia. It's a pleasure to have you join us today on the program. I don't know if I should pick your brain a little bit about the striking doctors, what you think, particularly this one that other bodies are gingering up, so to speak, to join in this strike. The 21-day ultimatum is over already. Yeah. If the strike started since 2nd of August and today is 30 already, so you see that I just don't know what to say at this moment.
Well, I, for one, I would want to appeal to government to come in and actually resolve this issue. Okay. Because the issue of the brain drain that we're experiencing in this country is because the government is not actually doing the needful. Okay. The fact that the doctors are the ones crying out loud now do not mean that the other health workers are actually comfortable. Okay. We are only hopeful that the demands of the NMA be met so that we can also have a platform to begin to ask for ours.
Okay.
The level of risk that the medical and health workers are exposed to in this nation is something that government really need to pay attention to in order to help in the area of the hazard allowance.
Yes.
Because often a time we see our colleagues going down, their health dwindling because of what they are exposed to on a daily basis. And these have not been properly compensated for by way of remuneration. Okay.
The doctors are not really asking for much. We're hoping that the government will do something. Exactly. But, you know, the patients out there may not understand what is happening because when two elephants fight, it's the grass that suffers. So the patients who go to the hospital and do not find a doctor will not think of government. Well, see, these doctors themselves, you know.
That's it.
So we're hoping and praying that this is resolved early enough, so that our doctors, our dear doctors, can go back to the hospital and then treat us. Okay, I know what I experienced when I went to the hospital last week. It was not funny. You know, it was not funny. All right, we're looking at malaria, doctor. Okay, I'm calling you doctor now. You're a medical scientist. Now, what is malaria?
Well, malaria is a disease that is caused by a microscopic organism known as the Plasmodium species, transmitted to humans by mosquitoes. Now, this malaria is able to cause some very striking infection and even death, or rather striking symptoms and even death in some cases when it is not attended to. So it can be very serious, leading to death.
Leading to death. Now, there's a question I need to ask you, because you are the people that will take blood samples and then go and check under the microscope to see if this person has malaria or does not have malaria. But unfortunately, only a handful go to that extent, or of course when there is an emergency, when the person thinks that, oh, the end is approaching, I need to run to the hospital. You know, when there is no crisis, people hardly go to the hospital to go and check. Now, when somebody comes to, you know, give blood samples, to check blood and all of that, how do you go about it before knowing that this person has malaria? What are the things you see in that blood?
Okay, and that's actually our professional service. We demonstrate the presence of the malaria parasite itself in the blood of the individual. That is a very cumbersome laboratory procedure that we do in the lab. So when we obtain blood samples from individuals, what we are looking at for is the presence of the malaria parasite. Once it is there, we say that individual has malaria.
Okay, so this parasite we're talking about now, you know, sometimes they will say, okay, there is 2.something%, there is, you know, a lot of, we want to know, at what point would you say, oh, this is serious?
Okay. Now,
how many percent?
Yeah,
you know?
The way of grading malaria parasitemia, that's talking about the level of the parasite in the blood. There are two different ways prescribed by WHO. One is the quantitative method, where you do a kind of a percentage count in ratio of the malaria parasite present to other blood cells like red blood cells and white blood cells. But the one that is mostly or commonly done around here is the one that we are just looking at. We do it in a graded form, where you say the individual has 1+ malaria, 2+ malaria, 3+ malaria, as the case may be. And either ways, it's dependent on the quantity, the amount that you are saying. So the WHO standard is that for you to be able to say an individual do not have malaria in his or her blood, is you would have gone through a certain rigorous process of going through the slide for about like 100 or 200 times. And depending on the number of parasites you see while going through, that's how you quantify and say this one has 1+ malaria, 2+, as the case may be.
Please explain that 1+, 2+, 3+ to us now.
Okay.
I really want to know, and I know some persons out there also want
All right. Now, for us, a lot of persons have actually confused that 1+, 2+, or 3+ to mean the level of severity of symptoms.
Exactly.
Which is not the case. The case is that we are looking at the level, how much of the parasite the individual has in his or her system, which does not oftentimes correlate with the level of symptoms. It all depends on the level of immunity of that individual. Okay. In some instances, you see an individual who has 1+ malaria, but that individual is looking so dizzy, looking as if for the intervention of God, he could even go in another few minutes. Whereas another individual will have 3+ malaria, and yet you look at the person is even bouncing and doing things. So that grading only looks at the level of the parasite in the blood, but not in the level of severity of symptoms, signs and symptoms, as many people confuse it to me.
Because just today I was at a pharmacy and somebody was talking on the phone. You know, sometimes when some of us talk on the phone, somebody at Ring Road or New Benin will be hearing, and the man was like, "Hey, what are you doing?" Apparently, the man does not live in town. Okay, he just came in town to find out that the child was sick. Took the child to the hospital and was saying, the child has 2+, 2+. Can you imagine? Where were you when all that was happening? You know. So that was why, and the man was really scared. He was really scared, and at a point, I became scared too. That for this child to have this grading of malaria parasite, and that means that child must be very, very ill. Sure, in some instances. But like I've just mentioned, it doesn't always correlate. But most often the time, the grading with pluses helps you to also know the severity. So that if anything goes wrong, that individual who has 3+ have the more likelihood to easily go down compared to the one who has 1+. I don't know if you get it. So it's a grading system that looks at severity, but in terms of clinical signs and symptoms, they do not often correlate to severity of clinical signs and symptoms. Okay, that's interesting. Now, the question I want to ask now is this. Malaria and fever, we confuse it all the time. We confuse both. So can you just tell us the difference between both? Okay. Fever is one of the clinical signs of malaria infection. Whereas an individual could have malaria infection and it may not have manifested in the clinical sign of fever. But if you take the blood sample of that individual, you will find malaria parasite there. Just like I mentioned, that immunity, the level of the immunity of that individual may make certain clinical signs not to be obvious at a particular point in time. So they are not the same thing. There are other infections or other diseases that can manifest in the form of fever. But malaria is one of such. But malaria itself cannot be called fever. That's interesting. So at least now most of us now know what to do. Now, there's this thing a lot of us do. The moment you touch somebody's body and is warm, this is malaria, without going to the hospital, without getting any confirmation from the doctor or the lab scientist. Once you touch a child or an adult, they say, or even if I touch myself, this must be malaria. And the next thing, you're running to the nearest chemist to buy drugs. For those who say, let me not just come down with this malaria, or before this thing will get me down, let me quickly go and get drugs. Please, this scenario, how does it play out medically? Okay. Now, medically, if you have pyrexia, what we call it in the medical field is pyrexia of unknown origin. That somebody is having high blood, or rather high body temperature. We say the temperature is rising above normal, and we now want to find the origin or the root cause of that high body temperature. Not that you will not conclude and say you have malaria already. So in doing that, you need to see your doctor and you need to visit a laboratory to do tests. Viral infections can cause fever, can make your body temperature to rise, as well as some other bacterial infection like infection of the blood, septicemia, and malaria itself. Today, the world is battling with COVID-19, and one of the symptoms of COVID-19 is high body temperature.
You know, so these are all what it entails. That when you see your blood, your body temperature rising, the best thing for you to do, instead of just jumping up to access drugs, medications without prescription, you need to find out the cause. What is the origin of this fever? You need to do that by visiting an accredited medical laboratory, or you see a doctor to look at other clinical signs that you may not have noticed. In the process of examination, those things will come out, and then it will inform him or her more on what to be done.
Okay, now the eyes, what relationship does the color of the eyes have with malaria?
Okay, now because malaria, the Plasmodium species that causes malaria, what it does is to destroy red blood cells in the body. Now, the destruction of red blood cells will lead to, let me not take you through the pathophysiology.
Please, you can take us through that if it's going to help me and every other person
we're trying to look at. Now, the destruction of the red blood cells will go through the normal reticuloendothelial system to read it off the system. And that will see to the urination passing out yellowish urine that you will see. And in some instances, because it will affect the blood that circulates in the body, is now being mixed with some already destroyed red blood cells. That could bring about yellowish coloration of the eyes.
Okay, so
but that happens in some very extreme cases where the individual has a very high degree of the malaria parasite present in his or her body and have not done anything about it.
Okay, so now it's possible for me to have malaria parasite without really coming down with a fever?
Yes, sure.
And I'll just be moving around?
And you just be moving around. But the danger in that is, over time, the parasite build up to the point where it actually now gets the individual down. That's why most times, like I was in one television program where somebody phoned in to ask that each time he or she stresses herself, that's when she begins to have the symptoms of malaria.
It happens to me
yes,
too.
the rationale behind that is because of the environment where we live in this country, and where we have the vector for malaria abundant everywhere, the female Anopheles mosquitoes, then what we begin to see is that individuals already have the infection of malaria, which their immune system is just trying to cope with. Because stress on its own also have a way of affecting the immune system. By the time you pass through a particular process of undergoing stress, then the likelihood are that you quickly now get down with malaria. Yes, that's
so
what
one has
happens.
to be very careful.
Sure.
Now, somebody asked me a question. Okay, I was discussing with somebody and he said she takes malaria medicine every month.
Okay.
Every month, without doctor's prescription, without doing anything or going to the lab. She just like to take it.
Okay.
You know, every month she just go buy drugs and say, okay, let me take this. I don't want to come down with malaria.
Yeah.
Please, is it proper? Is it right to do so?
Okay. In malaria control and elimination program, there is a prophylactic treatment for malaria that you are supposed to subscribe to monthly. There are drugs that you could take every month as prophylaxis against malaria. For instance, even in women, pregnant women, there are some prophylactic regimen of even weekly, just to help their body fight against malaria in order that they do not come down with malaria in the course of that pregnancy. So it depends on the drug that the individual is actually taking. One at this program, you cannot advise for the treatment. Yeah, that's what I'm saying. Undergoing malaria prophylaxis monthly it's actually with doctor's prescription, if you ask me, because it's actually a WHO recommendation for us in this part of the world, which many persons do not subscribe to because of our very low economic status. So, but
and bad attitude to hospital.
Part of it. So, but it now depends on the drug that the individual is taking. Because if you now go ahead and start to take the drug that is actually meant for treating malaria as prophylaxis, that's where the problem lies. I don't know if you understand the thin line. There is drug for prophylaxis and there is one for treatment when you have already gotten down with the infection. So these are two things.
So if you now mistake
one for the other, it becomes a problem of drug abuse actually. That's the truth.
Will that affect the individual in any way?
Well,
because we've heard that if you take too much of certain drugs, the kidney, the liver, some internal organs will be damaged or may shut down without even you knowing. So I want to know the implication of that action of that young lady without appropriate prescription.
Okay. Now the implication, firstly, apart from the damage that the drug may do internally, because there is actually a few drugs. I do not think there are any drugs that do not have adverse effects. Virtually every drug that you take for anything have got some adverse effects, including the anti-malaria drug. Although that's why it is not advisable that you take some of these drugs over and above the period of prescription. Otherwise, you could affect some of your internal organs. But the problem that individual is also creating is not for her alone, but for the entire community. In that, she is putting those anti-malaria drugs through a process where we will call selective pressure that could result in anti-malaria resistance. Do you understand? Over the counter use of some of these anti-malaria without prescription indiscriminately can lead to anti-malaria resistance, which becomes a problem because by the time the system already has enough of it and eventually she now gets down with malaria, obviously where we have gotten up to is that malaria to have infected her is now resistant to that drug, which she has abused over time. And that strain is in her. The mosquito picks it, takes it to another individual.
Person.
The whole environment is now laced with...
That particular individual is not only endangering herself now,
she
but
is
the
also
community.
Exactly.
Wow, that's serious. Okay. Now let's we're in a period where we're being advised to get vaccinated. Now somebody who is down with malaria, or somebody who has malaria parasite or any other ailment at all, can that person be vaccinated?
Yeah.
With the COVID-19 vaccination?
With the COVID-19 vaccination. In vaccination processes, what you should not be infected with for you not to be vaccinated is that particular infection that you are getting vaccination against. For instance, if you are going to be vaccinated against hepatitis B virus, you need not be infected with hepatitis B
before you get vaccinated.
So otherwise, it will result to a process that we call super infection, whereby, because most of these vaccines are subunits of the actual causative agent of the infection itself, or subunits attenuated or manipulated, kind of. So by the time you are already infected, for you to have been infected, it means your immune system was overwhelmed. Do you understand? Then now you are not getting vaccinated against that same stuff. It could lead to what we call super infection.
Wow. Because somebody called me and was asking a question that he's hypertensive, he's diabetic, and he's wondering if he should go, because a lot of persons do call into our radio program, confusing me for a doctor. I'm not a doctor, That he wants to know. He's diabetic, he's hypertensive, and he mentioned another thing. I can't remember that one. And his kids are telling him that he cannot go for the vaccination because something may happen to him because his immune system is already compromised. So can such a person go for take this vaccine?
For this COVID-19 vaccination, the recommended age to be vaccinated, once you meet it, you need to discuss with your doctor to actually look at your level of immunity before you can take vaccination, this vaccination. But so far so good. Even individuals who are known to have immune related diseases like HIV and all that have also been vaccinated without any problem. So I do not think that diabetics, though diabetics have impact on the immune system, but I do not think that it will also have effect in the case of this COVID-19 vaccination.
Okay, talking about COVID-19, once somebody is ill, you know, once you start coughing, the next thing people have is, I hope this will not be COVID-19. So how do we differentiate the COVID-19 and malaria?
Okay. Well, it's a little bit difficult in that the signs and symptoms of COVID-19 are virtually all of the signs and symptoms in malaria. The only thin line is the difficulty in breathing, which malaria have not been known for, that is associated with COVID-19.
This is Healthy Living on Independent Television, and my guest today is Lawrence Idemudia, a lab scientist, and we're looking at you, knowing your malaria status, how you can identify whether you have malaria or not, and then when you go to the lab and your malaria, the malaria parasite in you is graded, at least you would not have so much fear in you. You would know exactly what to do. But the important thing here is that no matter how you feel, no matter the condition, in as much as you know that your body, or you don't feel the way you used to feel, or there is something wrong with you, you may think it, okay, all right? But some persons will actually feel that something is wrong, but would ignore it. With what is happening in the world today, you should not ignore anything. Go to the hospital. At least let the professionals tell you that there is nothing wrong with you. Okay? It's not proper for you to ask a friend who will now recommend drugs for you. Oh, when it happened to me the other day, I took this, I took that. No, you might just be killing yourself. Now, let me quickly deviate a little bit. Somebody once told me that one can actually get poisoned on paracetamol. That is, you know, drugs like that.
Yeah. It's all called, yeah, sure.
That's too much of it.
Acetaminophen poisoning.
Okay.
That's too much of paracetamol.
Okay.
There are individuals who, in one way or the other, abuse paracetamol.
Okay.
When they do maybe many jobs and they get tired, they just come home. For them to be able to sleep, they need to take paracetamol.
Oh,
and over time, and before you know it, it comes to a point where it doesn't even work for them. They start using other stronger analgesics like Panadol, Tramadol, Diclofenac, and all of that. Now, it impacts on the liver. We have had people who have enlarged liver as a result of abuse of paracetamol and other analgesics. Some having even GTI perforation, with their GTI having these because they have abused analgesics.
What was the GTI?
That's the tube that runs from the mouth through the anus.
Okay.
So they have it.
So we have to be very careful, because that's one of the drugs that is readily available.
Sure.
Everybody can access it. Even I've seen those hawkers of herbal drink having packs and packs of this drug and selling to, and they will say, when you take this herbal medicine and this drug, you will feel very strong. You know, I used to wonder how people can actually do that. You're taking orthodox medicine and mixing it with herb and a little bit of alcohol. You know, they do that. And you see others, particularly those at the site or those who do very hard job. And you see them jumping, I can't pay, that kind of a thing. You are actually killing yourself, okay? Sure. You are actually killing yourself. We're here on this program to educate you, to inform you, and to make sure that you live well. Now, can you please tell us the relationship between malaria and typhoid, because that's another misconception when it comes to the issue of malaria. I remember somebody saying, I get typhoid. How you know so you get typhoid? You say, I know, you know, that she has been treating and treating since she's not getting relief. That means it's typhoid.
Yeah.
So tell us the relationship between malaria and typhoid and how to like distinguish between both.
Thank you very much. You see, malaria, I've heard someone saying, I had malaria and I tried to treat, the thing has migrated to typhoid. So some people feel that typhoid fever is the high form of malaria. And as such, if you have malaria, you know, somebody one day say, if you not treat and I may not go talk to typhoid. Very funny. And so now the truth is that malaria is a vector-borne disease transmitted to humans by mosquito, the Plasmodium parasite, Plasmodium falciparum, malariae, and all these different, about 5 known species of Plasmodium that causes malaria. Either of these will give you malaria, whereas typhoid fever is actually a foodborne infection that could lead to a kind of septicemia, your blood being infected by the Salmonella typhi or Salmonella paratyphi. So where you have that infection, you will now have fever as one of the clinical signs. That is typhoid fever. Yes, the common ideology is because the way our environment is in this country, the likelihood are that people will get down with typhoid. But that's not true. For you to diagnose typhoid fever in other clients where people take very good care of their heads, you need to have what we call paired sera, where you have an onset of infection. You quickly report in the hospital, they take your sample, they demonstrate whether there is increase in the titer for this typhoid fever. They will not attend to it at that point. You go back home. If after like a period you come back and then another sample is obtained, by the time there is an increase in that titer, that's where we say the individual have got typhoid fever, or you use other means like the stool sample or even blood to diagnose it. But here in this country, where we do not even produce majority of the things that we use for diagnosis, we get them imported. And at the point of entry, some of them may have even been compromised. Then we begin to hear people saying that they have typhoid fever, and you begin to wonder, where are they getting this information from? So it is not everything that is called typhoid fever that truly is. If you must say you have typhoid fever, like I mentioned before, it must be diagnosed from an accredited, a registered and licensed laboratory, where they actually do the needful, do the right things, and diagnose it and say you have typhoid fever. Whereas some of these charlatans begin to tell you if you feel like this, you feel like that. If your body is hitting you. I heard somebody saying that at a point where you have internal heat in your body, then you have typhoid fever. It's not true. Those may be part of the clinical signs, but the lab diagnosis must be done for you to say you have typhoid fever.
All right, it's Healthy Living on ITV. We'll take a very short break now. When we come back, we will begin to take your calls. Stay tuned. Thank you very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body. But the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contacting tuberculosis will be reduced.
If you're healthy, then you're wealthy. We appreciate you for staying tuned to the program Healthy Living on ITV. And we are looking at your knowing your malaria status, how you can go about it. Don't just sit down and think that because your body is hot, that means you have malaria, or because somebody says so, or if you don't treat malaria, it will not graduate to typhoid. No. I'm sure your mind has been disabused already, okay? So do not think that because you didn't treat malaria, but you must treat malaria, okay? If not, something may happen. At what point can somebody die? Because, you know, we look at malaria ordinarily, but I was surprised to hear that malaria kills and kills very fast too.
Very fast.
So please tell us, at what point do we get to that point, and what is the risk factor?
Malaria have been known to even kill more than HIV that people dread about, because the point at which malaria kills people can be very rapid. I mean the stages that it goes through before it can kill an individual. Where you begin to see, for instance, the malaria parasite transcend and move into the brain, where an individual has gone down with cerebral malaria. That at that point, you see the individual begins to even talk off point. Malaria can do that and make the individual to have some schizophrenic tendencies and all that. So it destroys, it can bring down the liver, can impact on some viscerals also, and then the individual packs up. So malaria kills.
Is that the point where you say this person has high fever?
Yeah, what? When the blood, sorry, I don't know why I'm using blood. When the body temperature is too high for the internal organs to cope with. So before you know it, the individual is gone.
Okay, I know that at this point you want to ask questions. The number is 052-290573. 052-290573. The number is on your screen right away. Give us a call. The scientist is here to answer your questions on how to know your malaria status, what you should do, where you should go, and how you can help yourself and those around you. All right, 052-290573. Give us a call. Let's see what we can do. Is it possible for one to live without malaria? You know, when you go and check your blood for malaria, you discover that, oh, I do not have malaria. Is it possible?
Yeah, if you adhere to some of the ways of preventing malaria.
Okay, let me pause you there and I'll take this call first. We'll continue. Hello, caller. Good afternoon. Okay, is it possible now for you to reduce the audio level on your radio set? Please, when you're calling, just reduce the audio level on your TV or move away completely from where your television is. If you do this, we'll be able to talk. Hello, caller. All right, while we're waiting for more call, please continue.
Okay. If you are there to the processes, or rather, do I say process, the preventive measures that should be...
sorry, Mr. Lawrence. Hello? Hello? All right, if your audio level is too loud, we won't take that call. Please continue. Sorry about that.
So the measures are, one, the use of insecticide-treated nets, which the government...
Hello, sorry, Lawrence. Hello, caller.
Good afternoon.
Good afternoon. Please tell us your name and ask your question relating to this issue.
My name is Inowani Patience.
Happy to hear from you, Patience.
Yes. See, more than 3 weeks I've been having malaria, and when I went to the hospital, they said my immune system is low. I don't know what I will be taking that will boost my immune system.
Did the doctor not prescribe something for you when you went to the hospital to boost your immune system?
No.
Okay. All right, Lawrence, that's a question for you.
Thank you. We cannot at this forum begin to prescribed for individuals. But I think that, like you rightly asked, if you had seen a medical doctor, he would have prescribed a regimen that will help bring up your immune system.
Yes.
But be that as it may, you still will have, my advice is that he or she, okay, I think it's a she, she will still have to do a comprehensive analysis to know what is wrong with the immune system. Could it be that they probably are saying that our PCV, that's our blood level, is low? Then she probably will have to get hematinics and some stuff that will help bring that up. Because malaria is not to doing that.
Okay, I think she should also go back to the hospital and complain to the doctor. Because she did say that the doctor did not prescribe for her what to do to help build her immune system. Yeah. Patients, you just have to go back to the hospital. All right? Hello, caller. Good afternoon.
Afternoon.
Please tell us your name.
Hello?
Hello, who's talking to us, please?
This Taiwo Mohammed.
Okay, Taiwo Mohammed, how are you?
Fine, ma'am.
Where are you calling from?
I like this year program.
Thank you.
Please help me ask doctor, what is the cause waist pain?
Waist pain?
Yes.
Okay, your waist they pain you, eh?
Yeah.
Okay. For how long now?
Getting 9 years.
9 years? You don't go hospital?
Yeah. I did go there now, but some come up medicine where doctor the writes for me. With the things now, if it will take me like 5 months, I is starting again.
Okay. Okay. Mr. Lawrence will talk to you now.
Well, waist pain. There are a lot of things that could cause body pains. One of the symptoms of malaria is there are malaise and body pain. So if you have waist pain, you need to see your doctor for 9 years. You need to see your doctor to have your body properly examined and probably also require some further investigations like scan and all the likes to know what is wrong there. Okay.
All right, while we're waiting for more calls, what can one do to prevent malaria? You were on it already.
Yeah. So we're looking at the preventive measures for malaria. Basically, we say do not keep stagnant waters and bushes around your environment where you live. Use insecticide-treated nets. And then you could also do the malaria prophylaxis that we talked about earlier. Yes. Then there are also some mosquito repellent cream that people use these days. You could use them.
How safe are those creams? Because these days we have more people coming down with kidney failures and all of that.
Kidney failure, skin cancer.
Yes. How safe are all of these mosquito repellent cream and all of that, you know? Okay. One has to be very careful these days.
It's important that one has to be careful, but I think that some of those creams have been analyzed and their safety, their level of safety have been well ascertained. Okay. I really think it's part of the measures that you need to use to prevent malaria. If you know you are going to a community that is known to be filled with mosquito, you do not need to go and expose yourself. It's just like the white men, when they visit Nigeria, they are compulsorily placed on malaria prophylaxis, compulsorily from their home country. That, in fact, they give them the dose that will cover them for the period that they are going to stay in Nigeria, because Nigeria is known to be an endemic country. In the same vein, you know of areas where they say it's filled with mosquito, like some people have talked about their experience in places like Lagos. You are going to visit Lagos, you could go with a mosquito repellent cream just to help yourself and ensure that you do not come down with malaria.
Okay, hello caller, good afternoon. Hello? Good afternoon. Is it possible, this little child again, is it possible for you to reduce the audio level on your television set when you are calling us? It makes it very difficult to talk. Hello? Hello, good afternoon. Please tell us your name and ask your question.
Hello.
Hello, I can hear you. Tell us your name and ask your question.
Okay, my name is Mohammed.
You are actually trying to talk to me and other persons here. If you are not audible, I wonder how I'm going to hear you. I'm actually straining my ears right now to hear you. All right, so we're just going to let that call go because when you're calling us, please project. Okay, you need to talk loud so that we can hear you, and then reduce the audio level on your television set. All right, so hello, caller. So, Lawrence, if we do all of this that you have mentioned, we'll be safe from malaria.
Yes.
Because it's quite interesting when you hear people coming into Nigeria from other countries and then they tell you that they do not have mosquitoes where they're coming from. It sounds strange, but it's true. Yeah. Is it possible for us to also get to that stage?
Very well. If we have government putting some level of concerted effort to really bring down mosquito infestation in this country, yes. I think we will go a long way. We have heard of some clients where their government do community spray, where they come and fumigate their environment to rid out mosquitoes in order for them to have a malaria-free country. Okay. We will advise our government to try to come into that because the level of economic loss to malaria annually is quite huge. Individuals have to spend, when you hear people, they tell you all year round they probably have to treat malaria for as much as 6 times or even more in a given year. And that money could have been put into some other venture. So if government will do the needful, I know there are a lot to be done on the part of the individual. Like a few years ago, we saw government rolling out the insecticide-treated nets, which some individuals have used as decoration in their houses to date. Some of them are even going to put it on some very, they have used it to do some very untold things that you will not even want to hear, and engage what it is actually intended for. And that's the area where we need to have some level of attitudinal change, where we need to do our own part of the bargain. The government can do a lot much more than they have done. Like the area of the prophylaxis treatment, they could also roll out that such a thing where individuals are given this drug. There was a time they talked about the gold leaf treatment program where malaria drugs were highly subsidized. But currently now, the cost for procuring malaria drug had gone back to normal, and even more than what it used to be. We do not have those subsidized drugs anymore and all that. So we need government to pay more attention. We can get Nigeria to be malaria-free someday.
Okay. Hello, caller. Hello. I was actually hearing a woman's voice on the tone. Hello. Good afternoon. Please tell us your name and where you're calling from.
Hello, calling from Kaduna.
Okay, you're welcome. Please go ahead.
Now, we know the normal notion of we Africans or Nigerians rather, they need to have malaria and typhoid for self-prescription. Yes. So now, the question is like this. What happens if one tends to prescribe self-prescription for himself in malaria, typhoid cases? So, let's say if the person gets better and use those drugs, is there a long-run effect?
No, please take that last one again. Is there what? Hello, take the last part of your question again.
Okay, is there a long-run effect while you prescribe drugs for yourself? Maybe even if those drugs work, in the long run, can they be a problem? Okay,
when you prescribe drugs for yourself, what's the long-term effect of prescribing? Yes, you just want to know the dangers of prescribing drugs for yourself long time.
Thank you. We have actually mentioned that in the course of this program, where you do self-medication. One, some of them may be injurious to you. There are, before you take any drug, there are some questions that may be asked. There are some of these drugs that do not go together.
Okay.
For instance, an individual who is being treated for schizophrenia with some antipsychotic drug, going to take anti-malaria like anti-metal-lumefantrine combination or any of these ACT, it can lead to some very strong adverse effects that you see the individual is almost as if the condition he or she will find him or herself will be worse than the malaria itself. Okay. Do you understand? So over the counter sales of drug, we know it's a common thing in this country.
Yes.
But we will want to say at this junction that it is important for you to get prescription before you go and buy drugs. It's important because the effect is enormous. We have talked in this program today about you bringing out or leading to a selective pressure that could lead to anti-malaria resistance. Then we have also talked about the ones that can injure your internal organs. And now we're not talking about you taking a particular drug that reacts with another drug that you do not know because you are engaging in self-medication. You bring these two drugs together and then you have a problem.
Have an explosion. That was quite fantastic. Okay, Mr. Lawrence, time is almost up, but I really enjoyed my time out with you on the program today.
Thank you.
And hopefully you will come again and do justice to this topic or any other topic. But before we leave finally, can you quickly, in a minute or so, tell us the symptoms we should look out for before we run to the hospital? Okay.
If you have fever, where you have that's high body temperature, you have chills, rigors, and then common symptoms of normal flu like having you are coughing, you are sneezing. All of these are symptoms of malaria. And once you see this, you need to get to the hospital.
And not do self-medication.
Yeah.
Okay, when other signs are present, please run to the nearest hospital, okay? And help yourself or somebody close to you who is having these symptoms. Do not, I repeat again, do not indulge in self-medication. It may just kill you without you knowing, particularly when you are on other drugs, okay? Do this for yourself and for those close to you, and this country will be a better place. Thank you very much, Lawrence, for finding time to be with us in the program again. All right, we'll see you again on Monday. But on Thursday, join us on 92.3 megahertz FM, the radio, where we do the Pidgin English version of this topic. Bye-bye.